Okay, we're live.
Lovely, thank you very much. Good evening, everybody, and welcome to tonight's meeting. My name is Councillor Alex Sanderson, and I will be taking the chair of the Health and Wellbeing Board this evening as Councillor Kwan is on medical leave. Before we start, I've got the standard housekeeping points. So this meeting is being live streamed to the Council's YouTube channel. By participating, you are consenting to being recorded. Please can everybody introduce themselves when they first address the committee. And as this meeting is being held online, it is an informal meeting. We took this decision because of the tube strikes and the challenges getting into the meeting. So decisions will be deferred to the next in-person meeting, which is, I was going to say later in the year, but I think it's in early January. Item 1, apologies for absence. Apologies for absence have been received from Councillor Bora Kwan. Item 2, declarations of interest. Do members of the board have any declarations of interest that they wish to prepare? Fine, thank you. Minutes and actions. Do members agree with the minutes of the meeting held on the 23rd of June 2025 as an accurate record? Great.
Agreed.
Nod enthusiastically at me. Lovely. Thank you very much. Wonderful. And then on to item 4, Better Care Fund Plan 2025-2026 and Quarter 1 Report 2025-2026. Again, as this is an informal meeting, the recommendations will have to be agreed at the following meeting. Could I hand over to Sarah Wright to present, please?
Apologies. Sorry, is the next item the Better Care Fund? Or are we deferring that item for decision?
You can present and we can
present it. Okay, so in short, so this is our Quarter 1 report for the Better Care Fund. I would normally co-present this with Sue Rooston from the ICB. It's a joint fund to support us with our statutory duties and working in an integrated way with our health colleagues around discharge of hospital admissions and supporting people to remain in the community. It essentially sets out how that spend has been allocated for Quarter 1 and the key targets in respect of that thereafter. So it's essentially a summary of the spend to date and how that's been allocated to the various projects. And it is a continuation of the plan that we had from the previous year. And that's a very, very short summary. I think we had taken a chair's decision outside of this meeting, but we can ratify at a later date, I think.
Any comments, questions on BCF? Fine, thank you. All right, well, we will hold approval on that until we can at the next meeting, but lovely, thank you very much. Item 5, Hammersmith and Fulham Safeguarding Adults Board Annual Report 2024-2025. Just to reiterate, Appendix 4 is exempt. If we do wish to discuss the contents of the appendix in private, the board will need to pass the resolution on the agenda to do so, and do so at the end of the meeting. Can I hand to Fiona Bateman, who's the independent chair of Hammersmith and Fulham Safeguarding Adults Board, for this paper, please? Welcome, Fiona.
Of course. Thanks ever so much. So I am conscious that you asked for us to introduce ourselves, but as you've already done that on my behalf, I'm really grateful. Just by way of a little bit of background, I was appointed head of independent chair of the Safeguarding Adult Board in June, I think, July last 2024. So we pretty much hit the ground running, if I'm perfectly honest. The members were incredibly welcoming, incredibly helpful to me, and gave me a really good steer as to where the strengths, where the weaknesses, where our opportunities were, and have really demonstrated a solid commitment throughout the period that I'm doing now, but equally since to kind of really thinking about how the Safeguarding Board could work to improve practice, and to really think about kind of addressing some of the significant challenges, not just in Hammersmith and Fulham, felt probably regionally, nationally, but I am conscious this is the first time I presented to this board and to this group of individuals. Forgive me, because I may be teaching you how to suck eggs, and I'm sorry for that. But I think it's probably really important to highlight that the work of the Safeguarding Adult Board is a collective. It is a partnership from more than just the local authority. But as the Health and Wellbeing Board will know, that is pretty much the day job. The work integrating between public health organisations, the local authority, housing, adult social care, community safety, and the police is integral to the work that we do. We are not operational, and we're not intended to be operational, but what we are expected to do is a sort of to test out and to improve where we find there are opportunities for improving the connections between the different statutory, voluntary sector organisations and with individuals, our residents, to look at specifically the risks for adults with care and support needs. So in respect of, if you think about it in the context of the Children's Partnership, which you will have had annual reports from as well, the defining characteristic is that there's somebody under the age of 18 who's at risk of abuse or neglect. And at that point, we should all be working together to protect that young person or child. More complicated by adults because it's not just a definitive on an age, which is usually pretty easy to ascertain. And one of the things that pretty much everywhere struggles with is ascertaining when it is that an adult with care and support needs becomes a statutory responsibility in the context of safeguarding. So Catherine is here, and for adult social care, we'll talk about the residents that require safe care and support needs, care plans and support because their care and support needs need to be managed and supported. There's a bit more of a nuance when it comes to safeguarding. People do not necessarily have to be in receipt of care in order to still be needing safeguarding. So, for example, and you'll see from the report, one of the things that we looked at really early on in response to a letter from the Minister for Housing was, actually how well are we responding to risks when it comes to adults who are rough sleeping in our local area. And I think we did phenomenally well to put forward a really robust response to that ministerial letter and to show that there is a significant amount of work to recognise and to identify when people are at risk. That said, we know from safeguarding adult reviews, including referrals we had during the period and work that's underway at the moment, that there is still we know there are still significant risks for that population and for other populations. So what we've tried to do within this annual report is really kind of focus in on the core functions of the Safeguarding Board, and the area where we have really focused this year has been on the safeguarding adult reviews. So the work that was undertaken both for the Alison and Brian that was published the year before to kind of ensure that that work is becoming embedded, but also to take and complete the work on the safeguarding adult review for Hassan. And during that period, we received quite a number of referrals. So that work is on outlined within the annual report and ongoing as we speak at the moment. It sometimes appears to be of concern where if you haven't had safeguarding adult reviews for a long period of time, there is a sudden rise. But actually, Hammersmith and Fulham, the fact that we've had quite a number of referrals is actually, I think, a suggestion of a good, healthy partnership that want to explore, want to learn, and want to look at cases where the outcome hasn't been what people wanted, to find out what more could be done, what could be done differently. I'm kind of hoping everybody's had the opportunity to go through the report. So sorry, Chair, I should have asked at the very beginning, how long have I got? And
we're reasonably flexible. I would say assume that people have read the report, but also highlight it just in case they haven't.
Okay. So yeah, no, that's really helpful. I won't go on too long because I really appreciate, but I do want to kind of highlight that there has been some significant work done. There is ongoing work done. The partnership has been really focused on that idea of a partnership, if that makes sense. So really keen to kind of think about how we work more collectively, how we identify the gaps that are coming out of safeguarding adult reviews, not just locally, but also some of the learning that's come from the national analysis of safeguarding adult reviews. We've done some work as well about kind of learning from other aspects. So, for example, we've had some really good engagement from Standing Together and from the domestic abuse lead to think about actually how we work collectively to really raise concern, raise improvement practice, and and address the key issues there, particularly when it's an older adult that's experiencing domestic abuse, and particularly where that abuse might be coming from somebody other than an intimate partner. So another member of the family, because there have been cases where we know that we've got learning to do in that respect. So one of the things that we were aware of and been working on during the period that I'm reporting on was that the case review group, so safeguarding adult reviews are a statutory function. Safeguarding boards must do them if the circumstances arise. And the decision making for that is at the SAB. It's for the SAB. It's not as it is with the Children's Partnership, identified as to be with the independent chair or the scrutineer now. But what we have always done, in common with most safeguarding adult boards, is delegate that to a subgroup. So the case review group have been doing that for many years. What we wanted to achieve and ensure was that the decision making there was really robust, really confident and comfortable. And so we've ensured it's populated by people who are really, they're the decision makers in respect to the statutory partners, but they're also able to reflect on and start to implement the learning that comes, because it's great and very important as a statutory function that we undertake the review, but sitting underneath that is the absolute requirement for partner organisations to then evidence what they've done to implement the learning from that review. And again, in common with the with a number of that so what question, what has this done, how has that, it's been a really key focus. So that meant that we needed to really think about how we give guidance and structure to that group, to think about how they make their decisions, but also work with the other subgroup, which is the quality and practice, to think about how we are demonstrating that learning is then embedded. So they've been quite busy. We've done an awful lot of let's get the frameworks right, let's ensure that the right decision and the right decision makers are in the right meetings, but we've also then ensured that the work that has been done, like the SAR has saying, kind of really does unpick and ensure that actually that evidence base, that narrative of what's happened to somebody, is taken forward into to the actual practice and to the strategies that it should. So Hussein, I'm hoping everybody's read, but this was a young person who was in transitions. He was supported by his family, having spent the majority of his childhood abroad. It was understood that he would need additional support, but he didn't have a diagnosis of a learning disability or autism, although they both were suspected. The report is shortly to be published, along with an introduction by me setting out what partners have done to implement the learning to affect the change that's needed, and in respect of the the questions and the suggestions of things that needed to be changed. Partners, accepted that and accepted the final recommendations, and have been very clear that they are, going to be working with the board to demonstrate that practice has been impactful. That those recommendations, those findings have been impactful on the recommendations changed. What the report really, it's worth taking the time to read the report. Not least because there's evidence in there of some actual really good practice. I know when we do reviews, because the outcome has been so awful, you tend to assume that everything must be bad, but actually we saw some really good work across the agencies, looking to try and support proactively. But fundamentally, one of the biggest things that was really difficult, and also difficult for the reviewers undertaking this, was really understanding and hearing Hussein's voice. And that's always a delicate balance when the people are supported by their families, because it's not always easy to say, actually, we hear your position, but we need to also be clear about whether that's the same for the individual. So there's some significant learning that needs to happen there. We know that the system is complex. It is very, there are at the moment a lot of delays, particularly for diagnosis of neurodiversity. And so one of the things that we are now exploring is, and it probably fits with the paper that would have been before this, but it's thinking along the lines of how do we support people to wait well, particularly in the context of neurodiversity, particularly in the context of poor mental health. As I say, the SARs that we've done, the SARs that we've looked at, and the ones that are ongoing, there are 5 further SARs at the moment. They're all the reason that they matter, the reason that they are a statutory function, is because that human story provides a really solid evidence base for what is needed for a change in policy or practice improvement initiatives. And it's important that we don't lose sight of the reasons why we're asking for the policies or the practice change. It's for me, it's really critical and important that safeguarding board partners recognise that this requires everyone to be open, transparent, and thinking about actually how does this not just influence practice at the front line, but influence the strategic decision making? How does it influence strategic policies? And that's one area where I think we want to really kind of work towards in the coming year. And certainly that was something that was decided in March when we all met. The report also goes into detail around kind of where we are on our strategic plan. We're sort of 2/3 of the way through for this one, and so a lot of the work that we're now looking to do is thinking about how we demonstrate that practice improvement, or that has influenced changed. You'll see in the report that it talks about the self-neglect audit, and that again identified some really positive practice change had resulted as a consequence of the learning from the 2 reviews in 2024. We did hold a number of lunch and learn sessions for practitioners. The idea was that they would grow and that people would find them useful and helpful. Unfortunately, the attendance wasn't as good as we'd hoped it would be, but we are keen to keep building on that and to find more opportunities, as you'll see from the report, for practitioners and team managers to really engage with the work of the board, to really think about actually how they take that learning into their work, but also how they feed out to us the information that we need to pass to you guys as decision makers, as the people who make the big decisions. So we've, I mean, I think it's I'm not quite sure what else to tell you. There is a lot in there.
It's such a rich report, and that was such a rich presentation. I think that covered absolutely everything in there. So thank you so much for the time and effort and the thoroughness which has gone into developing this report, and then to come and present it as well. It's wonderful to see, and welcome to the role. Obviously,
Thank you.
Mike, but it feels like you've really hit the ground running, and wonderful to see the work that's happening. I had a couple of questions.
Yeah,
I mean, one,
please.
and to be honest, you've covered most of them off. So the rise in referrals, obviously in some ways can look alarming, but as you say, it's a sign of much better partnership working, of that referral rate increasing. And my next one was about in the final year of that partnership, of impact measurement and what that was going to look like, which, to be honest, you sort of touched on anyway, really. So I'm going to throw it open to anyone else and see if they have questions on the report, and then see if anything else comes to me. Sue.
Hi. Hi, Fiona. Thank you so much for the report. It's been really.
Can we intro ourselves and where we're from as well?
Sobus, the VCS infrastructure provider. So We've been engaged with the Safeguarding Adults partnership for a few months now. It's been really great. Interested in looking at kind of the issues around cultural sensitivity for services, because I think it's multifaceted. There's still, in some communities, a huge mistrust of safeguarding and a huge reluctance to talk about it, to acknowledge it, to think about what needs to be done to safeguard individuals. There's also still remains quite a lack of understanding of what safeguarding actually means. And quite often we get calls from organisations who say, oh, we're worried about a particular individual. And they think, because they think the person is vulnerable and should be safeguarded, but then when it's looked into, they don't necessarily meet the criteria for being a vulnerable adult. So it's kind of looking at how we can improve the information that goes out to groups. Our recommendation is always, if in doubt, report it, and the local authority will pick it up. But it's also interesting to look at how those safeguarding procedures and staff and personnel can build their cultural sensitivity, if you like, about understanding the backgrounds of individuals and the communities they're from, and kind of looking at how their sort of engagement could elicit a more positive response from some. So we're really interested in kind of helping a sort of further dialogue around that with a number of VCS groups. And we're looking at whether that should sort of be incorporated into sort of safeguarding awareness sessions for groups. Most organisations will have a safeguarding policy in place, but I think a better understanding of what it means and what the procedures are, and again, how to make those services feel accessible to local residents who might be very fearful of them would be great. But it's great work, really great report. Love reading it and looking forward to the Safeguarding Board meeting tomorrow.
So I promise it wasn't a plant, that I didn't know she was going to ask this, but in terms of the cultural competency, that was one of the lunch and learns, because again, we recognise that is a really critical information. Like looking at the data, we were like, okay, we need to think about why is it that these certain groups, but equally, so, you know, your engagement with the board, it's so incredibly important. You are, as far as I'm concerned, the link to our eyes and ears to really valuable services. So yes, that's one of the areas where we want to be able to demonstrate we've had a much better impact over the next year. We have also been talking about cultural competency, cultural literacy in London region as well. And in doing so, I've been able to identify where there's been some very significant useful work that we can borrow with pride, or at least look at and see how we can adapt it to how it to help us and our frontline and, you know, senior staff work with and think about it in the context of this. So yes, cultural competency, really incredibly important. And hopefully what we'll see once we've done that is you know, some movement in that data that demonstrates that, yeah, people are more comfortable. We do tend to use a lot of words that actually don't mean a huge amount to people if they're not in this world. And I think safeguarding sometimes can be one of those. And it does become, sometimes for people, it is a fearful thing. They think of it in the context of, you know, individuals coming in, you know, in terms of a loss of rights. So simplifying and managing that in a much more effective way by just talking about, you know, we're there to ensure that adults who have care and support needs feel safe, is something that again came out of conversations with you know, our residents and experts by experience. So I'm really keen to kind of look at how we make our website more accessible for residents, and how we make meetings and how we engage directly with them. And I know that you've been working with Kerry on thinking about how we can do that more productively as well. So thank you. There'll be more to tell about next year, is what I'm saying, with Sue's help.
Thank you. Councillor Perez and then Jackie after.
Thank you very much, and thank you, Fiona, for the very thorough report. You explained about the importance of listening to the voices of adults with care and support needs, and the report also alludes to empowering adults to make decisions. The example that you alluded to and that was mentioned in the report, Hussein. I noticed as well that there's over resilience on Hussein's family to make decisions. So based on learnings and how you want to empower adults to make those decisions. So can you please tell us a little bit more of what steps you're taking to make sure that's implemented and what support is in place? Thank you.
So, yeah, of course.
Yeah,
So,
and Natalia, do you just want to say what your role is as well?
I'm sorry, yes. Councillor Natalia Perez, and I chair the Health and Adult Social Care Policy Accountability Committee.
Thank you.
So, and thank you. One of at a strategic level, the board will be looking at this in the context of, have we been able to, how does the reviews that we undertake this year demonstrate that practice has moved on from what it was for Hussein and Alison and Brian. We do that each time, what's changed, where are we seeing the practice improve? And likewise, when we did the self-neglect audit, we were able to see that actually practitioners are thinking much more carefully about trauma-informed responses. They're thinking much more carefully about how they engage, but there's still quite a lot of work to do. We are looking at strategic level when the QIP, the quality in practice, review very carefully the data that they get in, not just from the local authority. I should say we have this year been able to secure data from other partner agencies as well, and that is critical. This is a partnership. So when in the past we've been completely reliant on data and for the local authority and primarily for adult social care to provide, being able to widen that out and enable the triangulation, which really helps us understand actually, are we not just one part of our service, but as a collective, are our workforce understanding that they do need to engage with and hear the adult and see the adult and understand their risk. But at the strategic level, our focus is usually on kind of what we shorthand call making safeguarding personal principles. So we're looking at, were advocates involved when they should have been? Was the adult asked what the outcome they wanted from this intervention, and did they respond at the end saying whether that was met or not? So it's testing along the way whether that adult has that choice and control in respect of safeguarding. Now there is always a balance to be had, because just if the adult says, I don't want your help, doesn't mean that partner agencies can step away. If there's that statutory duty to safeguard, there has to be a balance. And one of the things that the reviews have identified is that it's not always that easy to understand that executive capacity for an adult to keep themselves safe, particularly where there might be other factors like many years of trauma, where there might be substance misuse, where there might be multiple layers of disadvantage. They may actually not even be particularly able to keep themselves safe. Say, for example, they're in a situation like cuckooing or domestic abuse. So all of these things mean that even if an adult says, I'm fine, can you leave me alone? We as professionals have to be really deep diving into that and explaining and being satisfied that it's safe for us to step away. And what we're really wanting to test out and check through is that that's done and understood, but also, and this is, again, a really incredibly important part of what we do and why it is a partnership, is that that's not done solely by one professional, that there is that joined up management of an understanding of risk across the different relevant organisations. And that's one of the things that the Hussein, Alison, Brian, the national SAR analysis across the whole country said this is one of our key areas, is that we cannot just think that if we badge something safeguarding, it ceases to be my responsibility and I can pass it to Catherine and her team to kind of take it on. That doesn't work. We know that doesn't work. What we're trying, the key message that as the partnership wants to get across is, if you think somebody needs to be safeguarded, that's not the point. A referral is not, raising a concern is not where you step away. It's when you step up. And we really need to build that kind of team around and collect in the way that you see happening where there's a risk to a child, in terms of that protective factor. And so that's our kind of key message. So that's the if you like, the culture change that we're hoping to influence, infect across the system.
Thank you, Fiona. Really interesting. Jackie.
Thank you, Fiona. And first of all, we really welcome your leadership as the chair, and I'm really also welcome the emphasis that you've just placed on the role of the partnership rather than an individual agency. And I think just having that reinforced and understood, and that idea of not stepping away but stepping up is something I'll take away from this evening very positive. You started to answer my question actually, which was about the use of performance data. And I suppose I had a particular question about how have you used performance data to surface early any potential practice issues in any agency across the partnership? Is it used proactively?
Yes, is the quick answer to that one, but I'll go into a little bit more detail. So the quality in practice subgroup scrutinised the data from local agencies very carefully. I, being a little bit, you know, at the end of the day, I'm the figurehead. I also, even though I don't sit on that subgroup because I shouldn't, I also do go through that data as well. But just to give you an example of my experience, when I came in June, July, adult social care, for example, were really open with, right, we've undertaken some work to look at where we need to, you know, where are our areas, where are our improvement. Here's the report, have a read of that, see the data, you know, see where you think the data could be improved, see how we can think about how actually we can implement. So I had that from adult social care. We also then looked at, as I say, we did a deep dive into transitional safeguarding. We did a deep dive into homelessness, and we pulled data from, you know, anyone that would give it to us, to be perfectly honest, because what we wanted to be able to evidence was that in those particular areas, we knew ourselves. We knew where we were doing well, but where we needed to improve. And then we could target the resources that we have. And, you know, we've got to be honest, very often we're talking about ensuring not that we're going to, you know, say, okay, well, we can put a big pot of money to do X, Y, and Z. What we're talking about is, right, we need the workforce to understand that they need to work in a different way so that actually, without additional money, without additional resource, this is better, you know, the outcomes we all want to achieve is more effective. We've done similar work. I mean, we've worked so closely with Nikki in public health around kind of, you know, the suicide prevention, looking at, you know, a whole range of issues to think about actually how do we use the information that you gather in public health to influence what we need to do as a partnership in terms of getting adults to be safe, adults with care and support needs higher up the agenda and safer. We similarly, when I looked at, you know, some of the data in respect of police concerns and police, you know, what used to be called Merlins, they've changed the name of it, which never helps because I don't like change for the sake of it. But what used to be called Merlins, and we know that has proven, like the number of police concerns that have come in, we were really conscious with right care, right person, that might change, that might drop off, and actually vulnerable individuals might be at risk. So we use the data not just from the local authority, but we cross-referred that with the information that was coming in from corporately from the Metropolitan Police to ensure that actually right care, right person is being implemented locally in a way that we're satisfied it is not putting people at risk and that it's manageable for other statutory emergency responders. So we're very, I am very data driven, if I'm perfectly honest. I feel more comfortable. For those of you who don't know me, I'm a lawyer by background, and although I rarely admit it, I love the detail. I love to know that if I have to, hand on heart, tell you guys or in court say we did this for these reasons, we can demonstrate why that is. So safeguarding adult reviews are a big part of why we do things, but actually we also need to know that you know, the data is there. So you'll see from the lunch and learns, for example, pretty much each one of those, I start with, this is your local population, this is the issue, and this is why we've chosen this as a topic. And it starts with the data, but then it goes on to, you know, this is the research and this is why we need to move to this. And so that's kind of how I use it. And that's why what we want at the end is a product like the annual report where we can turn around to you guys, but we can also turn around to our residents and say, we know that we are able to do X, Y, and Z well. We want to do A, B, and C in a different way because we think it will be better, and we're hoping that the data will show this. So that's the plan.
Thank you very much. Thank you. Catherine.
Thank you, Chair. I just wanted to echo Jackie's thanks to Fiona for her leadership. So again, thank you very much for that. But also just to, I suppose, enhance some of what Fiona has said around the performance data, because I think what's happened perhaps historically is that the data has been very local authority. And so therefore everything is focused on local authority performance, which is fine. Local authority have a very big role to play in this. But actually the approach of looking across the piece, and Fiona mentioned around homelessness, for example, and that threw up all sorts of really helpful conversations, discussions, things that we need to take forward to work differently because we were coming at it from a different perspective. It also meant partners have to kind of step up and own their data so we can all work together to get a better outcome. So I think it was just a really good example of what Fiona had said earlier about the partnership coming together as a partnership and all parts of that taking responsibility for their role in adult safeguarding.
Thank you. And Bryn, could you say what your role is as well? And Jackie, I can't remember if you did as well.
I didn't.
Sorry,
Apologies.
you did say that. Yeah, no. Shall I just say who I'm Catherine Wilmette, Director of Adult Social Care. Sorry.
Thank you very much. And Jackie?
Sorry, I'm Jackie McShannon, Executive Director of People. Thank you.
Very much. Thank you. I mean, it all sounds really, really positive direction that this is moving in. Also, we love data in people. So this is all music to our ears as well, because we love looking at data in almost tedious amounts of detail for other people, whereas we relish every part of it. So great. Thank you. Wonderful. Thank you very much. Anything else on this item? Fine. Conscious do we have councillor representation on, or member representation on the safeguarding board?
I think you did.
Right.
I will be dropping an email, probably to you, Councillor Perez, but I think it would be really good to re-establish that and to be engaging at that level as well. I think that would be really strong, because I think it is a really rewarding meeting. And actually, one of the things we really want to do is encourage that wider participation from politicians, but also, as I say, from the voluntary sector. And one of the other things that we're really keen to do is to think about actually how we engage with our residents directly as well, so that their voice is heard at that meeting.
Fine. We will take that one back and think about that. Thank you.
Thank you very much. Of course, very happy to contribute.
Great. Thank you very much.
Would it be okay if I ask a question before this stops? But I don't know if this is the right. I know that you had a conversation briefly around kind of membership of this meeting, but I know that the expectation is that we always, and statutory, we must bring the annual report to the Health and Wellbeing Board. I welcome thoughts on whether you think attendance by me more frequently might be useful. But I can just pose that as a query or as a question for you to think about, and then maybe come back and we can think about. Not every independent chair sits on Health and Wellbeing Board locally, but in the past I have, and thought it was helpful.
I have long thought that Health and Wellbeing Board has not represented every single aspect of health and wellbeing the way that it should. I think I would really welcome more active role of safeguarding on this board, which I think is brilliant. There's such wonderful health representation here this evening. I think safeguarding is also a really, really key part of all of that as well. So I would really welcome that. And thank you, Fiona. It's a really, really strong report. It's been really, really strong presentation, really, really rich in detail, really positive direction of travel. I think we'd all be delighted if you joined. So thank you very much for the offer. Thank you. Great, lovely. Right, well, moving on to another cheery subject then. Adult Community Specialist Palliative Care Services for residents in North West London. Sue, over to you.
Hi everybody, I'm Sue Rooston and I'm the Borough Director for Hammersmith and Fulham and work for North West London ICB. This is hopefully good news. We've got a few slides that went round in the pack. I don't know whether, David, you're going to share them, or should we just assume that everybody's looked at them? But for those...
If we can put them up, they are very dense slides, is my only thought about it. So I think we can, but as long as we just...
Well, don't worry, I can just talk to them and then people can sort of review them at their leisure.
Do we have them to put up, David?
I can put them over if you want them. So yeah, that's fine.
Yeah, perfect.
So just while David's doing that, for those that have been on a bit of a journey with us since 2021, when this piece of work started, hopefully people will be pleased to know that at the July board of the ICB, a business case was approved for North West London to increase the investment across the community specialty palliative care services. And what I wanted to do today was just bring, if you go to the next slide, sort of bring some news around what that means for Hammersmith and Fulham, because people, I guess, will now see what the reality is in terms of sort of the increase to services locally. So we've just got a few slides and some progress of sort of what happens next. So this slide, I do take your point, it is a busy slide, but on the left-hand side of the slide, we wanted to show what the current services were, and then obviously inform this group as well as others, our local population, around sort of what the changes are. So at the moment, we've got a palliative care team that supports 9 to 5, 7 days a week. That will increase hours and go to 8 to 8, 7 days a week. We don't have a hospice at home service within Hammersmith and Fulham, so that will be a new service that will be provided for the residents of Hammersmith and Fulham. At the moment, we have access to Royal Trinity and St John's Hospice, and one of the changes under the sort of the new way of working will be that residents of Hammersmith and Fulham will be able to access specialised hospice care from all of the North West London hospices, should they choose to. So that increases choice for our residents. I think one of the biggest enhancements is that we have been allocated funding for 5 new enhanced end-of-life care beds, which aren't hospice beds, but they are additional specialist palliative care, which would obviously have support from the palliative care teams as part of the service. We are currently just sort of looking at where we would do those, and I'll come on to sort of what the process for that would be. There's been an expansion around the specialist palliative care telephone line. At the moment, it only operates for people that are already known to the service, but this will expand to those that aren't known already, so that it can be accessed by anybody, including people that care for those residents. No change to the hospice outpatient and multidisciplinary clinics, because I think they are still sort of working well, and we will just keep those as usual. And then enhanced services in bereavement support. And again, a bit similar to, obviously Fiona was talking about sort of cultural competency and sort of various forms of training. There will also be improved training as part of the business case process to offer cultural competence across and reducing inequalities by sort of making the care much more personalised. So we wanted to sort of bring this. We know it has been sort of a bit of a lengthy journey. If you move on to the next slide, David. Again, a busy slide, but it just shows the timeline. We started this process in December 21, and it has taken through till July 2025 to get to this stage. And now we want to focus on the implementation. So that just gives the timeline. People can read that at their leisure. If you wanted to move to the next one. So essentially, we have taken this through sort of various rounds of consultation and engagement. The plan is now to have new contracts with providers in place by the 1st of October, which only gives us a couple of weeks. And for implementation for the inner cluster boroughs, so West London, Central and ourselves in H&F, we're finalising the timescales for each of those service lines. So we'll be sort of working with the central programme team at the ICB to work through those. We are going to be having a workshop, it says in September, but it's going to be mid-October, to talk about with our residents and engage on the enhanced end-of-life care bed locations. I know that Navneet's on the call, and we are working closely with CLCH to see whether or not we can co-locate those beds with West and Central, because it would give a totality of around 14 beds across the 3 boroughs. So we're looking at that at the moment. And then I think the final slide just shows what we would like to. So this is the engagement piece. So we're going to have a one-off workshop where we will have invite lots of residents to come and have that conversation with us. And then we will communicate with all of our stakeholders the process for this implementation. So again, what we would like is obviously to, where possible, and I know we've got Health Watch and we've got sort of various SOBUS on the call as well, to sort of try and encourage participation. We have been very fortunate that these have been sort of widely advertised, and we've had good engagement in all of the processes. So we want to continue that so that we can implement this in the best possible way. It says at the bottom that we're aiming to hold the workshops in September. I think it will now be mid-October, just because of getting venues and getting things organised. And then I think the final slide is around sort of how we can, what we would like sort of from a place perspective, so sort of members of this group, to look at helping us with the local implementation and the planning for the new model of care. The identification of the enhanced end-of-life care beds and the options appraisal. We're currently doing that at the moment, and then we'll come out to engage with people around that. August, September, it's already kicked into October, I'm afraid. And then obviously sort of tracking the oversight of delivery for us and support. So what I wanted to do, we had this bit of a conversation at the joint leadership team, and we wanted to bring this really to sort of share some positive news that's come out of a very lengthy process, and now obviously asking and seeking the health and wellbeing support for the ongoing implementation of what should be an enhanced service for the residents of Hammersmith and Fulham. I'll leave it there and happy to take any questions, and indeed we'll try and answer them. If not, I can refer back to our North West London colleagues. Thank you.
Thank you very much, Sue. That was a great presentation taking us through it, and some really good news there. The increased hours of support is a really good win, because obviously people aren't just dying 9 to 5. So wonderful to have that increased care. The end-of-life care beds, thank you for explaining the process there, because that was going to be one of my questions about how those locations were going to be decided and how much of a role we were going to play in that. Do people have questions on the palliative care paper? Fine, that feels like everything has been asked and answered then. Well, we will look forward to hearing more of the engagement about next steps, and please let us know how we can support. Thank you very much. Thank you. Lovely. Okay. Hammersmith and Fulham Health and Care Partnership 10-year health plan update. Caroline, can I come to you, and do you mind saying who you are and where you're from? Thank you.
Yeah, thank you, Chair. So I'm Caroline Farrer. I am Managing Director of the Hammersmith and Fulham Health and Care Partnership. So that's a role employed by Central London Community Healthcare on behalf of the whole of the Health and Care Partnership, encompassing the NHS organisations and the council. Can I just apologise, Chair, for being late this evening? I had a family matter that came up urgently to attend to. There's quite a lot of slides, so I'm not going to go through them one by one. I suppose what I just wanted to do is to give a brief introduction. I'm sure people are already familiar, because it's been more than 2 months now since the publication of the 10-year health plan for health, which is fit for the future. I think sometimes people call it the NHS plan, and although there is a lot in there about the NHS, it isn't intended to just be an NHS plan. It is intended to be about health. And fundamentally, the reason why the plan was published was because our services are increasingly becoming unsustainable and taking a greater and greater share of the tax burden on society. And the plan essentially throws down the gauntlet to local areas, to place and neighbourhood, and says, how are we going to, this is the way that we need to work to make our services more sustainable. So a fundamental shift towards more integrated delivery of health and care services, a shift from hospital to community, a shift from sickness to prevention, and a shift from analogue to digital. So the government's key shifts, and at the heart of it, the plan for neighbourhoods. So the idea being that we get closer to communities and that we work more effectively together as a partnership to deliver those changes laid out within the plan. I think people will also recognise that this is a time of very great change within the NHS itself. There's significant reductions in staffing and changes to the operating model for the whole of the NHS, which I've laid out within the report. So that's at national, regional and in ICB, Integrated Care Board levels. And so the NHS is part of the partnership, is very much still working its way through that, and there remain an awful lot of questions about how that will actually work in practice. And of course, there are many staff who are at risk of their roles, and it is a difficult time. At the same time, we also have we have the 10-year health plan, but we don't have a delivery plan. So we don't have information about how all of the parts of the plan are actually intended to work and what some of the levers and enablers will be. So it's very much about, this is an early headline around what the plan is all about, how we are intending to organise, to deliver and develop our thinking locally, but we don't have all the facts in front of us about how, so the how that will actually be delivered in practice. So we've still got quite a lot to work through, both locally, regionally and nationally. I think it is important to recognise that there are real opportunities. The demographic challenges that Lord Darcy recognised in his report last autumn and aren't going away anytime soon. And I think the NHS has had an ambition around a hospital to a community shift for a very long time, but we'll only make that real in practice if, as Matt would say to me, people stop turning up at his door, and actually we managed to be successful together in keeping people independent and living well in the community. So that is what this is all about, and that opportunity and making that shift real and happen in place. So I think it's going to take probably at least the rest of this financial year for us to solidify our thinking and our understanding together of what this means for us as a partnership and developing our plans. And it may be that we need to revisit our joint health and wellbeing strategy in the light of these developments when we know more, Councillor. So I'm happy to take any questions such that I can answer at this time. But yes, would just emphasise both the challenge and the opportunity. Thank you.
Thank you, Caroline. And I think obviously there are a number of conversations happening all the time about what the future is going to look like. And I think, as you say, there are both challenges of us moving to new models, including the new ICB model, and making sure that we've got a protected voice, but also opportunities. And again, just to reiterate, we are very, very keen to try any prevention pilots that might be in the offing, because we are very keen to make sure that all of our residents benefit from growing tech and changes, not just the digitally confident. Thank you very much, Jackie.
Thank you, Caroline. And obviously we've had lots of conversations and regular discussions. I speak as the Director of Children's Services, so there's that particular hat on, to understand a bit more about what attention will be given to children, young people, service to adolescents, and in the sort of a new model, and how can we use an integrated neighbourhood model and a kind of prevention approach, as Councillor said, to bring services to young people as opposed to asking young people to come to services. I just wondered whether there's been thinking around that. Thank you.
Thank you.
Sorry, Chair. I think it's very clear in the plan that it's intended to be a whole population approach. And I think there's something about us being really clear as a partnership about where our biggest challenges lie and how we want to work on those together. We brought colleagues together in a workshop last week across the local authority, the health partnership and the health part of the partnership, and the integrated health providers and the integrated care board, to explore together how we actually do some of that prevention work together and keep children and young people out of crisis, for example. And I think that there are clearly other elements to the story, including the children's social care reforms, for example, where we might need, it feels like a jigsaw puzzle that we need to work through together and understand. I think as a partnership, we're really clear, Jackie, that it is a whole population offer, and we're really interested in making this shift across the whole of our population, and so including children and young people in that integrated care offer. Does that answer the question?
Thank you. I suppose I had understood that there was new guidance perhaps released into health guidance around sort of that multi-disciplinary and multi-agency approach in the last couple of days. I'm not cited on it. I just wondered, is that something that health colleagues are thinking about? And I'm really keen that children's remains very high on the agenda. You know, we talk all the time around you know, thinking about integrated neighbourhood, or about the bigger population, which is adults, but actually the children's are very significant needs, and I just think there are opportunities for us to be creative going forward. Thank you.
Yeah, I haven't seen, sorry Chair, I haven't seen that guidance that you refer to yet. I did attend the Families First Pathfinder to learn about some of the great work that's been going on in some of those pathfinders, and thought that that was really interesting around how we can better connect our local authority and our health services to make sure that we're responding early to situations, keeping children safe and supporting their development. So yeah, I think that's really exciting and interesting work.
Thank you.
Thank you. Councillor Perez and then Navneet.
Thank you very much. Yes, so the report alludes to how we're going to be transitioning from being analog to digital, and it's a 10-year plan. So how do we envisage this change as well? What's going to happen in the future in terms of how we embrace this technology to nurture and support the NHS and the local government partnership as well? Thank you.
Yes, so I think there's an awful lot of focus within the plan on the NHS app and how we make the most of that opportunity. And certainly, I don't know whether others use it, but you can almost order a prescription while you're brushing your teeth if it's that easy. But there's a lot of people who don't know it's there. So I think if we're going to make the most of that opportunity, we're going to need to focus on digital exclusion and making sure that we don't have people who are left behind. Then there are a set of technologies which we know are new, so things like ambient voice technology and broader AI, and how that will impact on the development of services and our workforce, and how they will support and enable. But clearly there are multiple governance questions around that, around the clinical governance and making sure that that's actually safe for use in practice. So I know organisations are testing and trialling those kinds of approaches already. And then I think there's a huge amount in the delivery of the data and the really powerful analytics that the NHS has commissioned, and we've already got the WISIC, the whole systems integrated care data system in Northwest London, which brings together connected care across all our different organisations. And there's something about how do we make the most of utilising that data and the better analytical power that we can harness to understand and make the shift about where the opportunities really lie. So I think that those are probably three of the key areas, Councillor Perez. But I suppose I would also emphasise that one of the things the GPs talk to me about regularly is that we do have populations that find it harder to use or are digitally excluded, and we need to make sure that those parts of our communities are not left behind, and that people are still able to access services, and that we both work on supporting those people to better access digitally, but also that we maintain those open channels so that people can definitely still access services appropriately.
Thank you. Navneet, did you have your hand up?
I did. It was in response to the earlier question that Jackie had made. I can come back on that.
Yeah, would welcome.
Thank you. So I'm Navneet Willoughby. I'm the Director of Ops for the Inner Boroughs at Central London Community Health. And I guess just on the back of Jackie's question, I just wanted to say that from a provider perspective of children's services within Hammersmith and Fulham, I fully support Caroline and the partnership work that we're doing. And I think that there is some development underway of groups and how we're managing performance, as well as more strategic work. So just to reassure that from a partnership perspective, I'm working well with Caroline on that agenda as well, to make sure that there's good, because I totally hear your point around there's often a lot of discussion around the adult services, and that just prompted me as well, because we had a really great presentation on this from school nurses within Hammersmith and Fulham recently, and they very much made that point that we need to start there, and we need to make sure there's good focus and how that links through to the strategy that we've heard already this evening. So yeah, just to reinforce that support.
Thank you, because I think we're all for early intervention and prevention, but that doesn't just start at 18. It should start a lot earlier in lots of cases. Thank you very much. Jackie, did you want to come back on that specific point, and then I'll bring in Sue?
Yes, and apologies. And thank you, Navneet. That's really helpful. And I suppose, Councillor, and this is obviously open for discussion, but I have long wondered whether we should be thinking about a schools rep or an education rep on this board. Thank you.
Thank you very much. Let's take that offline and have a conversation about that, but more the merrier. Sue.
Thanks. I just wanted to comment on the point about digital exclusion and how it does feel to many as if the service they get, if they're not digitally included, is somewhat less than the quality of services that other people might be able to access. So we had somebody the other day that was saying they were just trying to get a repeat prescription and it kept going wrong, yet they couldn't get through to their GP surgery on the phone at all to query it. And the pharmacy that they usually get to is kind of simply blanking them to say, well, we can only dispense what's on the system. So it is a worry. I was doing a consultation event the other day, and I met with an elderly Spanish couple who they said, you know, we don't use online, we don't have email, we don't do text messages. For one thing, it comes through an interpreter. It comes through in English, and we can't understand it. So then we have to go to the issue of trying to find someone to interpret it for them. So I understand the push for digital. You know, it can be a lot faster, a lot more efficient, and it can save money. But for those that are digitally excluded, it just makes it feel like such a huge uphill battle to get anywhere. There we go. That's what I wanted to add.
Thank you. I think on that, we are obviously very mindful of people being digitally excluded. I think the number is higher than you might think it is, but I think we have a general approach where if someone can't read and can't access services because they can't read, we teach them to read. And it should be the same with digital access. If people can't use or can't access systems which could really, really make a positive benefit to their lives, let's support them in being able to access those, whatever the digital tools is. The NHS app may not be the silver bullet. There may be a variety of other tools that will come of age in time and in years to come. But let's make sure that we're embracing tech, but making sure everyone else can also embrace the tech as well through all sorts of different methods. And that doesn't just have to be the local authority. There are umpteen different providers of free digital upskilling teachings for all different cohorts as well, for all sorts of different needs. So I think let's obviously be very mindful of digital exclusion, but let's also not use that, not worry too much about that. That's going to stop us from moving forward and having progress as well. Thank you very much. Anything else on this paper? Lovely. Thank you very much, Caroline. Wonderful. Okay, I've lost my notes, but I know we're going on to CLCH org strategy next. So Navni, I think this might be over to you.
Yes, thank you. So just for order, I think I was just going to repeat my name and where I work. So I'm Navni Willoughby. I'm the Director of Ops for the Inner Boroughs at Central London Community Health. I'm really glad and very grateful to be able to present our organisational strategy. So this is obviously for the whole of CLCH, and we cover a number of regions and geographical locations, but very pertinent for Hammersmith and Fulham. I won't read the slides in this strategy paper that's been developed by our executive colleagues, but throughout the organisation there's been a lot of engagement. I won't read it by verbatim, but I will just pick out what I think are some of the key points. So on the first slide, there is a real focus on kind of four key areas that we feel that we have a real important place to play within the system. So improving outcomes in population health, tackling inequalities in outcomes, enhancing productivity and value for money, and helping the NHS support broader economic development. And those four, I guess, kind of key aims are really underpinned by the aims that include quality, the building of relationships, the sustainable services, and making a positive difference in the communities that we serve. So I guess really the summary of that slide is that is what we are aiming to deliver, both in terms of the day-to-day operational and contracted services that we're commissioned to provide, but also recognising our role in the wider system and in the borough as a whole. The second slide talks in a little bit more detail about the commitment we have as an organisation to creating the neighbourhood health service, which, as Caroline has already referred to, is heavily featured in the NHS 10-year plan. And these are kind of centred around three key points. So developing a core offer that improves outcomes and reduces unwarranted variation. And if I just touch on that, I think that piece of work is is a really valuable piece of work, because it is recognising that patients and communities receive different levels of care, some through historical reasons, some through different boroughs operating in different ways. But as practitioners and as providers, we want to be part of making sure that there is a core offer that includes everybody. And so for Hammersmith and Fulham, that's making sure that the residents and communities are receiving that sort of fundamental core offer and services that are delivered elsewhere in North West London. So that's a really important piece of work that is being developed by clinicians as well. To co-develop integrated models with our partners and communities to improve population health. That very much links to the core offer work, so they're both dependencies. But then the third box, as it were, or aim, is around an integrated workforce through leadership in the education and development. So really recognising our role and commitment to in making this and developing the workforce that's both kind of training and education and opportunities, as well as recruitment overall. And are we making sure that we're a good employer of choice, and what does that really look like? And then there's a little bit in here about the enabler function. So what's our infrastructure? And that will be through digital solutions that we've talked about. So what's our role as in supporting that aim that we just talked about now? And then the final slide talks about the 3 layers within this strategy. And I really personally, without sounding too cheesy, really like the way that this is presented, in that it's doing things well. So this is our day bread and butter, business as usual, making sure that we are continuing to deliver high quality services, doing things better. So where are we needing to improve, whether it be performance, quality, our workforce, our efficiencies, but then doing better things. So that is about really trying to shift how local care is delivered. And I think in those 3 slides, really what comes through and what is a real commitment as part of this strategy is the system working, the collaboration, the partnership, a commitment to making sure that we are striving for better relationships with all partners. And some of that work is very much already underway, some of it needs to be developed. And as a Director of Ops, my responsibility is to really take this strategy and see how it fits to our divisional priorities all the way down to service level, and making sure that our staff are enabled to deliver this. And that's it in a nutshell. I hope I've done it justice.
Okay, thank you very much, Navneet. Perfect. Any questions or comments on the org strategy? Jackie.
Navneet, thank you very much. And I just want to reflect that from the interactions that our organisation has been having with you and your organisation, including a meeting that Councillor and I both attended with other colleagues, with your Chief Exec earlier this week. I think we can see the benefits of that very constructive relationship and that leaning into and solution focused. And you know, there's a number of examples where we've had to work on quite fraught at times and difficult issues, but I know that there's been a mutual desire to come to a solution, and actually some of those have been very effective. So all I would want to say is I think that what you're talking about, in my experience, more recent experience, is reflective with our experience of you. I hope that's fair to say, and others may not agree, but that's certainly from my point of view.
Thank you very much, Jackie.
Thanks, Jackie. That's really great. And it's really great to hear. And I think that that's really mutual. A lot of what we try to deliver is really challenging, and we're trying to fix really big problems. And I really value those relationships too. And it's only ever going to be solved and moved and progressed with the work that we've done together. So I also sort of agree mutually. So thank you very much.
Lovely. Thank you very much. Right, I think we're at the end. Work programme. In fact, this was one of the very positive conversations earlier this week with CLCH, which was having external partners suggest items for the Health and Wellbeing Board agenda, particularly health. Would welcome those. So please do feel free to send in ideas. Dates of future meetings. December is being shifted, but otherwise we've got 18th of March and 22nd of June. And then I think my only other AOB is to say thank you to outgoing Health Watch member Nadia, who I think is here, and welcoming Diane. So thank you very much for years of service, Nadia, and I'm very much looking forward to working with you. Wonderful. Thank you very much, everyone. I hope you manage to stay dry if you're outside, and if you have got a journey back anywhere, I hope it goes as smoothly as possible. Thank you very much and good night.
Thank you very much, Chair. Thank you.
Thank you, Chair.